Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Welcome back to the Sit and Stay podcast brought to you by RipsyTech. I am one of your hosts, RipsyTech Product Manager Parker Anderson. As always, I am joined by RipsyTech founder and CEO, Tom Tarshis. Hi, Tom.
Hey, Parker. Good to see you.
Good to see you as well. So today we have a special episode that we wanted to talk about something that is on a lot of people's minds. And as you can see, we have a guest here, Sara Heron. We'll introduce Sara in a second, but to kind of give a primer for why we're all together here talking, we wanted to talk about how 2 weeks ago there was a shocking piece of news in that the United Healthcare CEO, Brian Thompson, was assassinated on the street, and many people across the country were very surprised to see what happened, but maybe more surprising than the act itself was the widespread public reaction to the news. So anywhere you went from social media and beyond, many people actually expressed indifference, or in some corners of the internet, even like approval, seeing this event as kind of a symbolic act against a healthcare system that they believe has failed them or done them wrong in some way. And we don't condone violence in any form here at the Sit and Stay podcast, but this response does highlight a deeper societal issue that we wanted to talk about today, which is the growing dissatisfaction with the American healthcare system. So in this episode, we're going to explore a little bit about why this reaction likely emerged, what it says about public sentiment, and what it might mean for the future of healthcare in America. So to do that, we brought in our good friend, Sara Heron, another child psychiatrist, along with Tom, the usual guest. So hi, Sara. Hi, Tom.
Hi. Thanks for having me.
And just to introduce Dr. Heron, or Sara, a little bit. Sara is actually the Chief Medical Officer for RipsyTech, so it's important to note that. And Sara is also the Executive Director for Bay Children's Services, which is the nonprofit I reference many times on the podcast. And Sara brings many years of experience and working in different systems with colleagues in different systems, has experienced frustrations firsthand with insurance companies and other aspects of care. And yes, anyone who's listened to a bunch of our shows know, I have made a lot of cynical or other comments about the general evilness of the health insurance industry through all these episodes. So we thought it would be good to bring in another guest and just sort of have a discussion on this topic. So thanks for joining us, Sara. And Parker will lead the sort of direct the flow, but on my mind is just any general opening thoughts on why were you interested in joining this episode, and just general thoughts on this event.
What were the other choices for other episodes I could have joined? I didn't know. No, I think you could have probably brought any mental health provider on, because I think we've all had experiences that are frustrating with insurance. Our patients have certainly complained about these things to us, and there are a lot of mental health providers who work in private practice, and so they may, or who have cash only practices, and so they may encounter this less, but they are probably a cash practice because they don't want to deal with insurance companies. So I don't think I'm unique, but I think I can offer just an alternate perspective, hopefully, or it was sad. I mean, I think that's the thing, is it is hard to separate, I think, any good human, but hopefully any good mental health provider too could sort of, it's tough to tease apart this bigger problem from a person's life. And so I know we're all three of us trying to be very cognizant and respectful of this person had a family, and we wouldn't this isn't the way we would have wanted to solve these issues. And it doesn't even solve these issues, which I'm sure we'll talk about the issues, but
like Tom said, I'll be here to kind of direct the conversation, hopefully give my 2 cents as the non-provider here, just, a consumer of the healthcare system. I've had my own fair share of tumbles, I guess, or stumbles with the healthcare system. I got my own personal issues, but I think to start with, let's talk about, why do we think people reacted to this tragedy with indifference? And what might this reveal about how the public perceives corporate healthcare entities like United Healthcare?
I'll let you go first, Sarah. Yeah.
I mean, one thing that's been on my mind in trying to understand this is there is I don't want to get too far off course, but there is like a greater context in this country of just frustration in general, and people feeling like those who have money and power get all of these sort of benefits and opportunities that other people don't. I think the health insurance companies are one representation of that, but I think that frustration is sort of everywhere, and people are looking for some way to get some justice, some way to, Parker, you were talking about sort of your own experiences with the health insurance company as a consumer, which, I am, and Tom is as well.
Yeah.
And
as citizens, we have to be.
Right. And you can be on the phone with these companies, probably the same with Cox Cable or whatever, and feel like you get nowhere. And so I think people are like, okay, somebody did something when I have felt so powerless. I think it's this indifference is because people feel so powerless, which is even more frustrating when it's something you're paying for, to sort of feel like I'm giving you my money in order to get something back, but I don't feel like I'm getting what I'm paying for. And there's nothing I can do about it. I think that, to me, is kind of what drives the response of, oh, somebody did something for us to try to right these injustices. Again, I don't think it worked that way, but that's maybe the emotion behind it.
Yeah. And I think the, right, it's very true. We have a dual perspective, one of dealing with insurance companies as consumers, and then another dealing with insurance companies to try to get care for our patients or get properly compensated for providing good care for our patients. And I think, well, as physicians, we're sort of able to play the physician card sometimes to get a little better care in the health insurance industry. So I think Sara and I have this card we can play that may not matter that much to the insurance companies, but in general, we know a little bit more about navigating the health insurance system. We know if we mention we're a doctor, everyone along the way is going to kind of step up their game to make it easier. And so that alleviates some of our pain points as a consumer. But I think in the battle for what we're trying to do for our patients and working for an entity that really tries to accept insurance and is not a cash only practice. And it's fair to say that at Bay Children's Services, United Healthcare is not one of the companies we've been able to go in network with, because they, offer reimbursement far below what other insurance companies offer. And there's even been, different times in my life where I've sort of posted big signs in the lobby around, United Healthcare made X billion in profits, but they won't give us this extra $4. And quickly someone with a cooler head said, Tom, maybe you should take that down. And so which was correct, but that was like my frustration boiling over, that we couldn't get them to pay just a fair rate for providing, good health care to a kid with mental health issues.
I'm thinking too, because you're bringing up thinking about it as providers. And like, as frustrated as I get as a consumer, I do think I get more frustrated on behalf of my patients, particularly with experiences. Like, for me, there's been some inconveniences, but when I really struggle is, I remember, I will never forget this patient who, adolescent patient who was coming out of the hospital, and was trying to get into an intensive outpatient program I was participating in. And this person on the phone is just telling me that they don't need it, even though they were in the hospital for being suicidal. And so it's like, that's not an inconvenience. This is life or death. And I'm seeing this person in front of me, and you're telling me they don't need this thing that I've been trained to assess them for over the phone. And then trying to get a clear answer about, okay, what do you need to know? What are the criteria for a patient to be able to access services and use their insurance to get these services? And they won't tell you. It's like this black box, and that feels criminal. That's where I really get worked up. And again, I think that's, again, some of the anger from people online who have had these experiences, who have lost loved ones. Like, we've seen stories where, like, this patient was okay, but where it doesn't end that way, where somebody didn't get the care they needed. And not just in mental health, but people who go years without getting basic preventative care, and then they have these illnesses. I don't know. It's tragic. I think of people who get cancer and then can't get insurance. And I know there's more rules around that now, but I still think that insurance companies get away with a whole lot.
Yeah. How to respond to that? I agree with everything that you said. As somebody who used to have to do those authorization phone calls with the insurance companies for intensive outpatient programs, that was, the least favorite part of my job. Like, my primary responsibility was be working in groups, but I also had a responsibility to make sure that everybody was covered to actually be in that group, and that brought its own stress. And I totally empathize with that experience of, like, yeah, I'm there, I'm seeing this patient every single day, and I am very eloquently explaining why this person needs services, and the case manager will just come up with any number of reasons why they think the care is not appropriate. Not every insurance company, in regards to the mental health benefits for these patients, was difficult like that. Some ask a lot of questions. Some ask actually no questions, and they just say, "Cool, they're approved for this many days." It's like, great, all right, we're solid. And it is incredibly frustrating when you have to have that conversation with somebody to basically inform them that, like, hey, we have not been successful with securing in-network benefits for continued visits yet, and you have to have a conversation with the patient or with their parents and try to explain that. And that's a conversation that nobody wants to have. And speaking of, like, my own frustrations, like, I had a colonoscopy like 2.5 years ago. I'm a little young to have a colonoscopy, but it was family history stuff. And the GI specialist that I was talking to, who recommended it to me, I asked them, like, well, the first thing I want to know is how much is that going to cost? And they said, well, like, it ought to be covered. So I said, great. And so, I looked at my benefits and everything, and I looked at the chart and everything, and everything seemed to fully communicate to me, like, yes, this will be covered. So I went through with it, and then a month later, I get a bill for $1,000. And the reason being that it was a diagnostic procedure versus a screening procedure. It'd be fully covered if it was a screening procedure, but because it was diagnostic, it was not covered. So that's $1,000 down the drain, where everything was poorly communicated to me at every step of the process, where I tried to do my homework. So, rant over, but, all that to say, like, it's, even as somebody who works in this field, who tries to really know their stuff when it comes to communicating with the insurance company, they will still get one over on me. And that is frustrating.
Yeah, the lack of transparency. And again, for people who, like, work in healthcare and still can't figure out these systems, like, I mean, what about people who are less savvy or less sort of, informed. I think it is, again, it's that lack of transparency that's going to breed suspicion, even paranoia. You're like, well, if you're not, what are you doing behind that screen? Even if you're not doing anything bad, people will think you are because you're not telling them.
Yeah. And we're trying to simplify this process with our EHR with doing these benefit checks, so we can query the insurance company and check out the benefits and what's covered. But I have to say, and we're going to run the statistics on how much it's often, but I was just working with another company where, we ran the benefit check. It says there's this benefit, but you know what? I always wait until the claim is paid and you see what actually happens, just because of either on the gentle end, it's incompetence with, having things updated correct on the insurance data system, or it's sort of intentional thwarting of anything having to do with insurance coverage. And another thing we're running the statistics on and we collect in Ripsy is, how often there are issues with insurances. And Sarah will know this, but although we are not in network with United Healthcare, we do have around 10 single case agreements with United Healthcare or their affiliates. And I'll tell you that even though we managed to work out reasonable reimbursement, our finance director is usually chatting me, these are not worth the hassle, because the rejection rate, even though the correct authorization number's in there and we've done everything correctly,
it's so inefficient.
Yeah, and she's on the phone all the time trying to get things corrected, and there's still problems going back months where she feels it's not even worth it. Of course, we're doing it for our patients and other reasons as well, but
sorry, I didn't mean to interrupt.
No, and I think it just sort of does lead to, these are for-profit publicly traded companies, where and there's the one business philosophy that if you're a for-profit public company, your only mission is to maximize profits. And that's what these companies should be doing. And that is very at odds with being taking good care of your clients health-wise. And there's
interest.
Yeah.
So I want to talk a little bit about, the shift, whether there will be a shift, if there is a shift happening. If you think anything is going to start changing in a more positive direction, let's maybe start there before I dive a little deeper.
I mean, hopefully there's awareness and going to be more conversation. That's the hope. Again, I feel like these things pop up and then something else pops up and it can get forgotten, unfortunately. But
the news cycle.
Right. And I think, and this is true of so many things, like people don't know how to change it. Again, like the system has to really be overhauled, because like, as Tom said, how are you going to satisfy both patients and investors? Somebody has to be less greedy, I guess, is the answer. And like, that's not a big thing in our capitalist society. Like how are you going to convince people to not want what they want, or something that benefits them, even though, again, as we see, like what benefits this side is hurting the other. I don't know. That is such a big question. How do you convince people this is important?
Yeah, and then Tom, before we get your response, I'm gonna add a little bit extra to this question. I'm gonna skip to the last question that we had on our list, was in regards to how can healthcare providers play a more active role in advocating for systemic change within the healthcare industry? What might that advocacy look like? Go ahead.
Yeah. No, well, the one thing that will change is the CEOs of health insurance companies will demand security details for a while and have that covered. So that might be the extent. It'll be interesting if a year from now there's something that happens. There is this well-known, doctors used to sort of run the businesses and care for the patients and provide the care. That started drastically changing in the 1980s to now. It's very rare for any doctors to actually run even as their small family practice clinic. The numbers have shockingly dropped, and the doctors are not the ones in the lead positions of these companies. Doctors have, and other workers have sort of become widgets in the system of providing services, and it's just another number for generating some of the, for making the profit machine churn. I do think that there's a lot of power yielded by doctors and clinicians. And if there was, we have the American Medical Association, we have other big groups, could there be the only chance for significant change is getting some of these huge medical groups to organize, not a revolt or a strike, but some more ownership of people who went into healthcare to take good care of patients and pushing it back to this is a right, not an option. And we need to do some, if we're not, socialized medicine is kind of out of the picture because of lots of financial factors and how things are done in our country. But I do think the one thing that could shake it up would be a massive push by doctors and other healthcare workers to kind of revolt against the insurance companies. I think it's sort of tired people who've spent a lot of years studying hard and don't necessarily have the energy to do that. And people are trying to live their lives. And this is a quite a big challenge. I think, even in just trying to help design better systems around youth mental health, that's what I think Sara and I are trying to do, or why we work for a nonprofit and why we're trying to bring in technology to help with that care. But even doing that is a lot, I guess.
Yeah, I mean, that's what you bring in the technology piece. That was the one other thing I was thinking is, I wouldn't be taking insurance, I don't think, if it weren't for, this is not to be a huge plug, but for RipsyTech, because it does give me, again, as an MD, I don't know a lot of my way around the insurance company and navigating that. And so it gives me the tools I need to be able to serve clients who take insurance. And again, the more, I think the more providers, like you said, sort of strength in numbers, the more providers who were engaging with insurance companies, the more pressure we could apply. But so many people opt out. And again, I understand why. It's a real headache. But RipsyTech does lower the threshold for how much of a headache it is. And so that's another, I don't know, Google and Facebook and all these other sort of technology, powerhouses are applying a lot of these things to, I think, other areas of need, and maybe healthcare is one where technology could play a bigger role to move things forward.
In the context of mental health care, do you think that this is going to have any kind of impact on, how many mental health care providers choose to not take insurance and make their practice all cash based?
I feel like it's already unequal, right? I mean, there's the Mental Health Parity Act, but it's not really honored or enforced, I don't think. And so already, if anything, I have seen more physicians in other fields moving towards the way psychiatrists are doing it, that you're seeing a lot more of these people who get frustrated, providers get frustrated with insurance, and then you can't find a pediatrician who takes your insurance. It's all these small concierge practices, which then is this huge inequity because many people just cannot afford or access that. And then I think we also see fewer people just going into medicine, which is going to be a real problem if we don't have doctors. But like, you know, the job with all of these headaches, it doesn't look so glamorous as maybe it used to be as a job. I mean, you really have to love it.
Well, I don't know about I don't know the statistics. I think all the medical schools are still filled, but I think what you're seeing is, and this has been recent, people used to go into medicine because of this in general, because of altruistic feelings, and they want to really help society, etc. And now the reality is a lot of people have done it because, well, it's a reasonable job that you do sort of have a guaranteed 6-figure more income. And it's one of the few jobs where when you're 50, you can kind of do it forever, where, you're not going to be becoming outdated tech worker or something else. It's one of these, okay, you do a lot of suffering to get there, but it's a stable career and it can go further. So for checking the boxes off a job, but it's it's not the same altruistic sacrifice your life for the well-being of patients. And in general, there's a shift like this in medicine. And certainly when you see, and again, physicians in general are well paid compared to the rest of the country. But when you see, a lot of the people calling the shots, just treating the physicians as widgets, it does create these issues. And the other trends are, the number of people in cash practices, and Sara alluded to this, it has been steadily increasing. And now we're seeing it in other fields, which is very true. And will this have just another sort of confirmation that, yeah, hey, just don't deal with these insurance companies and avoid it. Look at what happened, and you don't want to get embroiled in these other topics. So it might have some impact. Probably not huge in mental health, I think, but
it's funny because I feel like there are some people who it becomes more about practicality to become a physician and less about altruism. But given the headaches we described, I think like some people have to be like extra altruistic because they really want to help people and they're willing to, like, again, I feel like I'm jumping through a lot of hoops to be able to provide care to more people, and it's worth it. It's part of my mission and my oath, I feel like, as a physician, but it's not what I went to medical school for. This part.
Right. While we still have time, I want to kind of put the focus on these questions in regards to the actual, how this might affect what care looks like with your patients. First, I want to start with this question about, actually, no, I'm going to skip that question. Could mental health care providers see a shift in how patients discuss or view their insurance coverage during a session? Might that be shaken up at all?
Yeah, I mean, again, I think the awareness thing and like so many subjects in society, like now this is safe to talk about, like that it's kind of taken center stage and people are maybe feel more comfortable speaking up or speaking out. It's interesting. I mean, Parker, when you told your story, you like actually asked your doctor. And I think, again, with the lack of transparency, people could talk about it, but still not get very far. I think like that's the thing is I feel like patients could bring it up. Doctors could try to provide an answer, and both of them could be so wrong in terms of what's actually going to happen after a visit, right? Even I have a patient who's more savvy, and they just said, we're not going to start until we get that first claim processed and see. And I totally get it. But it's very inefficient care. This patient then wasn't receiving treatment for a number of weeks while we were waiting for that. And it also meant I was holding a slot and not seeing other patients who could be receiving care. So I think patients and providers will be talking about it more. We'll continue to talk about it. My concern is, how do we loop back to the insurance companies and get them to be collaborative.
Well, yeah, and the way the doctor should have answered your question, Parker, is, I would hope it would be covered, and it's what I recommend. Ultimately, I'm not the person to answer your question. Here's this person on my team, but here's the codes I'll be billing. You should really call your insurance. And like, even if you decided, hey, I'm going to complain and file a lawsuit, or I'm just going to complain because my doctor said it'd be covered and $1,000 is a lot of money to me and I don't have it. Like, even if the doctor said, I did tell Parker that it would be covered, you've definitely signed something that says it is your responsibility to know your insurance benefits.
Yeah. Right.
And we have our patients sign that as well, that we really try to do our best with everything. And we put the cash rates on the website. So worst case scenario, this is what you'd be paying. But it's unfortunate that we ultimately have to put that burden back on patients to try to figure it out. Yeah. And I think like Sara said, that, the good part is we need to have more upfront conversations around the costs of healthcare and does insurance cover it, and be comfortable managing that within the therapeutic relationship.
I was thinking it's interesting how skewed my view is, because I think about your situation, Parker, and I'm thinking, well, had the physician known, maybe it could have been billed as a screening rather than a diagnostic exam. But that's actually the wrong way to think about it. The better question is, why is the diagnostic exam not covered by insurance?
Right.
Like, in the first place.
Yeah, this is making me think of a number of questions. One, I guess the first question would be, do providers have a responsibility to better understand how insurance billing works? But then my follow-up question to that is that taught at all in medical school? And if not, should it be?
It is not at all, at least when I went to medical school, which was a ways back. No discussions around billing.
Well, they don't even tell doctors how to write a check, or what to do with their own finances. And this is a well-known topic that, because of the way medicine is corporate and business, that these things should be taught very openly, and they definitely are not. Even grad people who finished medical school and 7-year residencies,
right? They don't take residency or fellowship either.
May have no understanding of the CPT codes and billing and things like that. I think it is possible you can work in a setting where you have a good billing team to refer people to, or maybe you work for Kaiser, where it is true that then you don't need to worry about that, because the people who are seeing you there are within an HMO system, and you don't. There was a very good mentor of mine many years ago, before I went to medical school, who his ethical decision was to work for a healthcare system like Kaiser, because he felt like among the places he could work, it was, the least greedy, or
the profits constrain things there too, because everything's covered, but you can't get in. At least
your doctor will see you for 15 minutes tops, and then they'll try to get you out of there as quick as possible.
And he's an interventional cardiologist, so he was protected from some of the
mental health
other piece. But yeah.
Well, now I don't want to open a can of worms, but I don't have Kaiser anymore. Granted, I don't live in an area that really has one that's nearby, but even when I did have Kaiser, I mean, mental health benefits were practically zilch. I mean, I had to call a number of people, and one of my coworkers at the time had told me, oh, hey, this one time I got mental health benefits through a carve-out that Kaiser referred me to. And so I had to call Kaiser and basically make that same argument. They said, oh, yeah, we can do that. And, and that's how I got to see an outpatient therapist. And
it's like the secret menu at In-N-Out.
Right. all that was made available to me was like, oh, you could see a psychiatrist, or there's like these groups that happen. I'm like, okay, well that's not really what I'm looking for. So versus now having the insurance that I have now, I could find any mental health provider, and I can quite confidently feel like it's only going to cost me a $30 copay to see a therapist.
I was just thinking the other way, because I'm sure Kaiser was something offered through your employer, right? But I think I'm just thinking of another avenue that, like, with some of these larger companies, I think they do have better health insurance plan options, and can employees push their employers to, we could push companies out of the market that are not doing right by their clients, right? And sort of say, well, Cigna is offering sort of the most, the best care for patients. So let's get that plan. And again, it's more expensive for the employer, but again, strength in numbers, that might be a way to push things.
Yeah, no. Well, and I wonder, I know we're coming to the end of our time for this one, and certainly the conversation could go on, a lot longer. So, and it opens up so many, historical, future, it touches on so many aspects of, broken pieces of the healthcare system in general, and then the mental health care system as well.
I mean, this has been a great discussion. I feel like we could go 3 times longer than we're planning to go, but perhaps we could do a follow-up in a few months or something, see, check in, has anything changed?
That's a really good idea. Yeah.
All right. Before we wrap up, anything else that you'd like to say?
Thank you for having me and letting me be part of the conversation.
Of course. Thanks for joining us. Yeah, we appreciate it.
It was a great discussion. All right. Thank you again for joining us on this week's episode of the Sit and Stay podcast. We're planning on getting this one out the week before Christmas. So, if you're listening to this then, happy holidays. And if you have any questions you want to submit to us for an audience Q&A, or you're interested in being a guest on the show like Sara, send us an email at sitandstay@RipsyTech.com. All right. Thank you both.
Thanks, everyone.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.